Hi, I'm Liz Lempert, Mayor of Princeton, with today's daily coronavirus update. For today's update, we'll hear from our health officer, Jeffrey Grosser.
Hello, Princeton residents. We are officially in social distancing week 2. For today's coronavirus message, I will be speaking about vulnerable populations and hospital surge. Most Americans now know that the coronavirus that causes a respiratory disease, COVID-19, is especially dangerous for the elderly and people in nursing homes. Although people over 60 in good health might not consider themselves elderly or especially vulnerable, these are the individuals who should be central to our efforts in reducing exposure and transmission of the disease. It is important for governments to promote social distancing across every age group, to break chains of transmission, and to slow the number of people who become sick with COVID-19. The vast majority of people who have serious complications from the infection have been over 60. In New Jersey, that number ranges from 57 to 91. In Italy, which is one of the oldest populations in the world, nearly 3/4 of deaths have been among people over the age of 70. Data from China also indicates that patients over the age of 60 are most likely to require intensive care. If we could prevent these high-risk individuals over 60, including the currently healthy ones, from becoming infected, it would greatly reduce the strain on our healthcare system. So how do we know this? One way is by learning from the experiences of South Korea and Singapore, which have experienced vastly different epidemics as compared with Italy. What current data suggests is that we need active approaches to ensure that the elderly don't become infected. It's good that states are posting guidelines for nursing homes, assisted living, and other long-term care facilities and promoting policies that ban or limit visitors to these facilities, but this simply isn't enough. We are actively monitoring these facilities to ensure they are following guidelines and adhering to proper infection control practices. We are also ensuring that these facilities are appropriately resourced to keep residents safe during the COVID-19 pandemic. These facilities are receiving priority access to diagnostic testing when necessary. Staff are also being asked to be monitored by their supervisors and managers to make sure they are not ill, just as the municipality is dealing with their first responders, including police, fire, and EMS. But importantly, we also need to protect seniors who live in communities outside of long-term care facilities. We need much more public health messaging that is specifically tailored to older individuals, and also relying on our citizens to push the message of, if it's not essential, just stay home. If your neighbor needs something, help them out. In order to limit their circulation in public and stay home as much as possible, older residents may need assistance and support from employers, private sector, and younger individuals to help with food and obtaining necessities. Seniors also need targeted and specific advice for how to protect themselves in the event that they do not have to go out, such as frequent hand washing, consolidating trips, avoiding indoor places where people gather, using hand sanitizers while running errands, and taking advantage of early opening hours at locations in town. All of these special hours from locations can be found on www.princetoncovid.org. Beyond collective efforts to reduce the surge of cases, messages are also emphasizing personal responsibility to protect each other and reduce potential need for hospitalization and severe hospital resources. These protective messages are being reinforced by the governor's executive order, as well as Mayor Lempert's emergency declaration, which was stated more than a week ago. Prioritizing resources and attention to the population most likely to produce the greatest number of severe illnesses has the best chance of preventing the overwhelming hospital surge we are seeing in parts of Italy, and we are anticipating to happen in the United States. Some of these efforts to anticipate such surges include preparing additional patient beds in temporary hospital structures. Municipal officials are actively working with county, regional, state, and federal authorities to prepare for this potential need. I'm proud of Princeton for a first full week of dedicated social distancing, but we're not out of the woods yet. We need continued community support to reap the benefits of reducing disease transmission from coronavirus. Thank you.
Thanks, Jeff. I want to thank you, the members of the Board of Health, and the Health Department for all that you're doing to keep our community safe during this crisis. Remember, we are all in this together.